Hey everyone, I thought it would be a good idea to start a YouTube channel just to inform everybody what's going on. That way you don't have to call all the time, or I mean, if you still want to call, that's great. But just for everybody who wants to know what's going on with this whole cancer journey, I figured this would be the easiest way to update everybody. So I'll start out with, I'm Laura, I'm 49. On October 15th, I was diagnosed with metastatic invasive carcinoma. I have a tumor in my right breast and a swollen lymph node in my right axilla. The lymph node is the reason why it's called metastatic, because it has traveled outside of the breast. And I started the Keynote 522 regimen on December 3rd. That regimen is 6 months of neoadjuvant chemo, so chemo before surgery. So the first 4 infusions, which are 3 weeks apart, are 2 chemo drugs called paclitaxel and carboplatin. Paclitaxel is otherwise known as Taxol, and carboplatin is otherwise known as Paraplatin. And then alongside that, I get an infusion of Keytruda, which is an immunotherapy drug. It's trying to teach my immune system to recognize cancer cells and go in there and pew, 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 blast them out. The first infusion went very well. It was 7 days ago. Part of the reason why I wanted to get this video filmed right now, because I still have hair, and they say that you start losing your hair within the first 2, sometimes 3 weeks if you're lucky, from the first infusion. That's when, so probably this time next week, I will start having clumps fall out, and at that point I will probably shave my head, and I will probably film it. So anybody else who comes across this video that's going along this, you will know what it's like, or what my experience of it was like. I also did not say the malignancy is triple negative, which means there are 2 hormone receptors and a protein receptor on breast cancer cells. There's the estrogen receptor, there is the progesterone receptor, and then there's the HER2 protein. I have tested negative for all 3, which back in the day wasn't really the greatest, because they didn't have a lot of treatment options or targeted treatment options for triple negative breast cancer. Since the advent of Keynote 522, the addition of the Keytruda drug, things have greatly improved for triple negative breast cancer patients. So I'm hoping that applies to me. When getting this, they will give you a port. So I don't even remember the day. It was a couple weeks ago. I had port placement. So this, look at that thing. It looks like it's an alien jumping out of my chest. So this thing sits right here, and it's got a little catheter that goes up here and goes inside, and it gets dumped into a vein. So I was prescribed a lidocaine-based cream I put this on here, the cream on here, an hour before they're going to do anything. So when you go to get an infusion, which I have to get on a plane to drive over to fly over to Charlevoix, and I have to go the day before the infusion because they have to do a blood draw and do labs. And with the labs, they're just checking your liver enzymes, just everything, your white blood cell count. Those are the two primary things because that's what chemo hits the hardest. Because if you have neutropenia, which is a low white blood cell count, you have to delay the chemo because it's no bueno. So yeah, going over for an infusion is just it's not a one-day thing. It's going over the day before to get labs done. And then my infusion usually starts at 8 a.m. and it takes about 4.5 hours. If there are no bad reactions. So the first part of the infusion, they give you your pre-meds, like Benadryl and a bunch of anti-nausea medication. And that takes about a half an hour. And obviously the Benadryl is to stop any allergic reactions that might possibly occur with the chemo drugs and the Keytruda. My infusion on December 3rd went very well. I did not have any reactions. Near the end of the Taxol, well, let me back up 2 seconds. So the first block is your pre-meds. Then I get the carboplatin, and that's about a half hour. Then I get the Taxol, and that's my biggest one. That's about 3 hours. And then after that is Keytruda, and that's a half hour. And then they put this little doodad on me called an on-body injector. And it's this little gizmo that is programmed to give me an injection of Neulasta 27 hours after my chemo infusion has come to an end. And the Neulasta is to get your body making white blood cells, so that way you can avoid neutropenia. Unfortunately, a lovely side effect that comes with it is muscle and bone pain. Typically associated with the legs. That's where mine was at. But back to the infusion. I didn't have any reactions. But near the end of the Taxol, I started to get really warm. Like I had just exercised heavily or something. So I told the nurse about it. Thankfully, it was at the very end, so they didn't have to do anything about it. So my infusion total should be around 4.5 hours, but that's if there are no complications. If you come across a complication, they got to slow everything down, give you more allergy medication, and then start it back up, but at a slower pace. Hopefully, because the first infusion went well, I'm hoping that the second one will go well, but they say you never know. With each infusion, something new could pop up, or it could just be smooth sailing. You don't know. So the first 4 infusions I have that are spaced 3 weeks apart are the carboplatin, the Taxol, and the Keytruda. And that equals about 3 months. At that time, I think I might get a scan or something. We don't know for sure yet. I will be talking with my oncologist about any possible clinical trials that I might qualify for. But if we're going to continue on with the Keynote 522 regimen, then the next block is a 3-month block, also 4 infusions spaced 3 weeks apart of doxorubicin and cyclophosphamide. Doxorubicin has the lovely nickname of the Red Devil for its Kool-Aid red color and its not so fun side effects. We'll see. Some people do fine on it, even though it's not a walk in the park, and other people have problems with it. So at this point, it's just, that's Buster in the back growling, if you can hear him. So we're just going to take it one day at a time. What else? I think that's all I got for right now. If anybody has any questions, put them in the comments. I will answer questions. If there's something else you want answered, because I plan on doing more videos. If there's anything else you'd like answered, put it in the comments. I will answer them. But for right now, doing pretty good. Still have hair. And, oh, the next infusion is set for Christmas Eve. So, and then the last flight back to the island on Christmas Eve, if weather is good, is 2:30 in the afternoon. Now, on the 17th, I have to go over to talk with the oncologist. So I'm going to ask him, he sees patients in Traverse City and in Charlevoix. His Charlevoix people, he sees Monday, Wednesday, and Friday. I'm going to ask him if maybe I could get it done Tuesday, the 23rd. If he's in Traverse City, I don't mind driving there. Just because I don't want to spend Christmas on the mainland. They don't fly on Christmas, so I'd have to wait till the 26th to come home. Again, if weather permits. So, that's all I got right now. Hit the like button, hit the subscribe button if you want to keep up to date with what's going on, because I plan on doing many more of these. And that's about it. Talk to you later. Bye.